2024 semester. Thank you all for attending today's presentation. For those that don't know me, my name is Adam Sizemore, and I'll be the moderator for today's presentation. Before we begin and I introduce Dr. Baker, I'd like to make a few comments as I always do. We have questions for the speaker. We will save them for the end in a Q&A time concluding her presentation. And if we have any students in the audience that are here for bonus, I have sign-up sheets in the bag. I have a general sign-up sheet, and then I have one specific for certain faculty in that, so make sure that you sign that, and I'll communicate that with your respective faculty. So without further delay, it's my pleasure to introduce today's speaker, Dr. Kristina Baker. Dr. Baker is an assistant professor in the Department of Psychology who holds a PhD in experimental psychology from the University of Toledo. Her research interests focus on children and adolescents within the criminal legal system. She's published in journals Law and Human Behavior, Journal of Human Trafficking, and Criminal Justice and Behavior. This current presentation is on research that is part of a collaborative project on sentencing decisions of juvenile defendants experiencing autism spectrum disorder. And without further delay, it's all yours.
Well, thank you for that warm introduction, and thank you everybody for coming to hear about my research that I've been doing. So, as Adam mentioned, my name is Kristina Baker, and I'm going to be talking about some research I've done since coming to USI on defendants experiencing autism spectrum disorder, how defendant race and offense type affect juror decision. So before I dive in and tell you guys, apparently my clicker didn't let me. That's okay. So before I just dive in and tell you about my research, I first want to make a note that this project would not have been possible without my amazing collaborators from different universities and within the Federal Judicial Center and by the College of Liberal Arts, who actually funded this project through CLAFTA. So thank you so much for supporting my research and that I'm going to share with you guys. So first I want to tell you guys about autism spectrum disorder. So throughout the presentation, you'll see the terminology ASD. This is just referring to that disorder, and I'll shorten it as saying autism. But autism encompasses a range of different neurodevelopmental conditions and is referred to as a spectrum disorder due to the broad range of symptoms and the varying degree of severity experienced by individuals who have this disorder. Individuals who experience autism might display a variety of different symptoms, such as atypical eye contact. They might have unusual gestures and stereotyped body movements, unusual expression of emotion, as well as different limitations in their social skills and their empathy. While we know that the prevalence in the United States in autism is about 1 in 36 children within the general population, its prevalence within the criminal legal system is less clear and potentially higher. So some studies have suggested that individuals with autism may be overrepresented within the criminal legal system, with about 2% anywhere to 27% of the prison population having this disorder. This potential overrepresentation of individuals experiencing autism within the criminal legal system may be attributed to several different factors, such as their autism characteristics, external perceptions that folks have on these individuals, as well as challenges in accurately measuring its prevalence. Autism symptoms in general are not going to be predictive of any violent or criminal behavior. Nevertheless, we do have research that suggests that individuals who do experience autism, when they become involved in the criminal legal system, when you attach that label of autism to their descriptions, it can affect their treatment as well as their punishment in important ways. So in what ways are those? Well, some studies have shown that mock jurors, which are just lay people who could serve as a potential juror in a trial, may potentially be more lenient towards defendants experiencing autism, so more lenient in their sentencing, giving a non-guilty verdict, but also less harsh sentencing decisions in general. But other studies have actually shown that defendants experiencing autism may be perceived as less credible and actually may be more likely to be guilty or to be found criminally guilty in court cases. How labeling a defendant with autism affects these legal cases has been a subject of significant research and debate, and studies have really found mixed evidence, or there isn't a conclusive decision in this field, So when thinking about judges in particular, some judges may view autism as a mitigating factor during sentencing, but research shows that an autism label can also serve as an aggravating factor in certain cases, which can potentially lead to these harsher sentences or even increased perceptions of how dangerous these individuals are. Additionally, jurors are often going to lack awareness of how these different autism characteristics can influence their behavior, leading to a potential misperception that can affect verdicts and also sentencing decisions. So in thinking about jurors determining credibility, we know that they're often going to determine credibility based on a wide range of factors, and some of these might be related to autism, so including those verbal and non-verbal type of cues, so things like eye contact, body movement and fidgeting, and even your display of emotion. And we know that these different verbal and non-verbal cues are going to be particularly important when considering a defendant who experiences autism, because individuals with autism may struggle with maintaining this typical eye contact, with exhibiting repetitive and unusual body movement, and display their emotions differently than individuals who are not experiencing autism. This relationship between an autism label and sentencing decisions may also depend on a variety of different secondary factors. So in my study in particular, I'm going to talk about two different factors. The first is going to be offense type. So what was the crime that the defendant was charged with? And I'm also going to talk about racial identity. So specifically thinking about, was the defendant white or were they black? So one legally relevant factor that affects legal decisions is going to be that offense type. So particularly whether or not a defendant is charged with a violent or a non-violent offense. So an example of a violent offense could be something like assault and battery, and an example of a non-violent offense could be something like theft of like a video game or theft of some other item. So we know that research indicates that when defendants who experience autism, they're going to be perceived differently based on the severity, but also the type of offense that was committed. So a recent systematic review found that jurors are going to view violent offenses committed by individuals experiencing autism as more indicative and inherent of dangerousness, while these non-violent offenses might elicit more empathy from those jurors or those lay people and more of an understanding of that defendant's just condition and how those characteristics of that condition may have impacted their behavior in that non-violent offense. Studies also show that in general, when an individual experiences a mental disorder, in general, regardless of what that mental disorder is, they're often perceived as more dangerous than someone who does not experience a mental disorder. And we see that this is especially for when a violent offense is committed. So public perception tends to exaggerate this link between mental illness and dangerousness or violent behaviors. But today it's kind of unclear on whether autism has similar effects to this perception as just general mental disorders in general. I'm also going to talk about an extra legal factor of racial identity and how racial identity may affect how a defendant who experiences autism is viewed and treated within the criminal legal system. So research shows that defendant's race can affect sentencing decisions, with racial biases leading to harsher penalties for minority defendants, regardless of the nature of the offense. So regardless of if it is a violent or a non-violent offense. So we also see that in particular with autism, there's minority groups often face disparities in autism diagnosis. So being diagnosed with this condition. We see that minorities are often less likely to be diagnosed, and we do see disparities where they're underrepresented in the childhood data. So thinking about minority children are less likely to be diagnosed with autism compared to a white child. And this underrepresentation may result in lack of social support and even misinterpretation of behaviors in different legal settings. And that brings me to our present study. So our present study was an experimental design where we sought to understand how an autism label various defendant characteristics, specifically their racial identity, and the nature of the offense is going to intersect to impact legal outcomes. So thinking about sentencing and verdict decisions. So specifically, we were determining if and how credibility evaluations and sentencing decisions may be affected by providing information about a juvenile defendant's autism label, varying whether that juvenile defendant is charged with committing a violent or a non-violent offense. So in our study, that violent offense was assault and battery of a store worker, and the non-violent offense was the theft of a video game involving trains at a local mall. And finally, we manipulated the defendant's race. And we did this by showing participants either a face of a neutral facial expression of a white individual or a black individual. So these were all taken from the Chicago Face database, and we just showed that picture. So in our study, I'm going to be talking to you today about our primary source data. So our primary source data is 511 lay people who were recruited from Prolific. But we also did a replication study, a partial replication, where we collected an undergraduate sample to see whether or not these results replicated. So in this primary source data, we found that we had about 50% that were female and 50% that were male. We had a wide age range from 18 to 89 years old with a mean age of 35. A majority of our sample was white, even though it was a nationally represented sample. We found that 71% of our sample was white. And when thinking about participants' verdict, and I'm going to talk more about this later on when I discuss the results, but most people did find the juvenile defendant guilty. So what did participants actually do in our study? So there was really these three different components that participants went through. So as I mentioned, we had an autism label condition. And folks who were in that autism label condition, they read a brief statement about autism. And they were told that this juvenile defendant had an autism diagnosis, and they were given different information about what is autism and how can that autism diagnosis impact that juvenile's behavior. Then, regardless of which condition they were in, all participants read one case vignette and a transcript. So the transcript was of that defendant testifying in court. And this is where we manipulated our three independent variables, which was the defendant label. So did they have an autism diagnosis or an autism label, yes or no? Was their race white or black? And again, we manipulated that race by showing a picture and also by changing the name of the juvenile defendant. And then they either read about a violent offense or a non-violent offense. Regardless of which condition participants were randomly assigned, all the case vignettes and transcripts were relatively the same amount of words, so relatively all of the same. We then had a variety of different outcome variables. So we measured verdicts, so did someone vote guilty or not guilty in the case. We also looked at a variety of different sentencing decisions, as well as punishment decisions. What were their goals of that punishment? We then looked at credibility evaluations, so things like likability and honesty, and then we had a stigma measure. So for the sake of today's presentation though, I'm only going to be talking about verdict, sentencing decisions, and credibility evaluations, but I'd be happy to talk later on about the punishment and stigma if anyone was interested. So the first outcome I'll talk to you about is verdict. So when thinking about our verdict and our sentencing, participants, after they read through this case vignette and transcript, they were asked to fill out several questionnaires in a Qualtrics survey. And one of them included giving a dichotomous verdict decision. So do you believe that the juvenile defendant is guilty or not guilty? Participants who rendered a guilty verdict were then followed up and asked how harshly should the defendant be sentenced. So only participants who rendered a guilty verdict would ask this, because if you rendered a not guilty verdict, there would be no sentencing that would happen. So you wouldn't need to determine that harsh or lenient sentencing. Additionally, we asked a variety of different sentencing questions. For today's talk, I'm only going to focus on the question of whether the defendant's mental health should be taken into consideration when deciding his sentence. But we also asked some other ones that didn't have any significant results, such as like, how certain are you in your verdict decision? We also looked at various credibility evaluations, and these credibility evaluations were measured as possible mediating variables between our independent variables and our sentencing decisions. And we asked 4 different questions that got at credibility evaluations. So based on Mars et al., we asked how likable do you find the defendant, what level of cognitive functioning do you think the defendant has, and how honest do you find the defendant on 7-point Likert scales. And then we wanted to expand on this previous research study. So we asked, how believable do you find the defendant in the information that they're giving you? Again, on that 7-point Likert scale. In regard to what we found, collapsed across all of our different experimental conditions, so combining our autism label, defendant race, and our offense type that people are randomly assigned, we saw that the case mostly yielded guilty verdicts. So about 74% or 378 participants out of our 511 said that the defendant was guilty in this case. So then to assess our effects of our experimental variables on our verdict decisions, we conducted a hierarchical logistical regression where we entered main effects into step 1 and then those interaction terms into step 2. And what we found was that step 1, or where we entered all of those main effects, that was significant. So specifically, we found that participants were more likely to give a guilty verdict when the defendant did not have a label compared to when they did have an autism label. We also found that participants were more likely to give a guilty verdict when the defendant allegedly committed this violent offense of assault and battery versus that non-violent offense of theft of a video game. And then contrary to our expectations and what previous research suggested, we found more guilty verdicts when the defendant was white versus when they were black. Unfortunately, when we looked at our step 2 or all of those interaction terms, we didn't find any significance there. So I won't dive into those non-significant results. So the main purpose of our study was to look at these different mediation models. And what we did here was we entered our experimental manipulation of either autism label, present or absent, our defendant race, white or black, and our offense type, either violent or nonviolent, as our independent variable. We then entered one of our credibility evaluations as a mediating variable, so either likability, honesty, believability, and cognitive functioning. And then as our dependent variable in our model, we entered sentencing decisions. So specifically, we entered that harsh sentencing, or how harsh are you going to sentence this person, and how much are they going to consider the defendant's mental health in their sentencing. So it's important to note that we only conducted mediation models if the results of an analysis of variance found significant effects between the independent variable and the dependent variable, as well as significant effects between the credibility evaluation and that dependent variable of the sentencing decision. So what did we actually find? So in thinking about our label conditions, so again, did the defendant have an autism label, or did they not have an autism label? So on this slide, I'll be talking about the model where our independent variable is our label, autism label, and then a variety of different credibility evaluations as our mediating variables, and our sentencing decision we'll be looking at is a harsh sentencing. And what we found is that participants who read about a defendant experiencing autism, who reported greater likability, they also gave less harsh sentences after rendering a guilty verdict. We also saw that participants who were told that the defendant has autism, who reported more honesty in that defendant, they also led to less harsh sentencing decisions. And finally, participants in the autism label condition who reported greater believability of that defendant also led to more support and lenient sentencing. So really what we found was that these mediators of likability, honesty, and believability, when they were rated higher on these credibility evaluations, a defendant who was experiencing autism also received less harsh sentencing after a guilty verdict was rendered. When thinking about our second dependent variable or sentencing decision of mental health consideration, we found that participants who were in the autism label condition, who expressed more likability towards the defendant, also considered the defendant's mental health more than other participants. That participants in the autism label condition who reported greater honesty also led to greater consideration of that defendant's mental health. And then finally, when individuals reported greater believability in that autism label condition, that it led them to more consideration of their mental health. So again, to recap this slide, participants who read about an individual, a juvenile defendant experiencing autism, when they expressed higher likability, honesty, and believability, it also led them to then consider that defendant's mental health more. Thinking about offense type, we only conducted a mediation analysis with the harsh sentencing dependent variable because our analysis of variances for the mental health considerations came back non-significant. And what we found was that, unfortunately, there was no significant mediation in this model. So when we entered that offense type condition of either violent or non-violent offense, and when we entered likability specifically as that mediator, as that credibility evaluation, and harsh sentencing decision as the outcome or the dependent variable, we didn't find any significant differences. The last set of models I want to talk to you about today are when we use the defendant race as the independent variable. So here we have the defendant race as the independent variable, our various credibility evaluations as mediators, and then mental health consideration and sentencing as our dependent variable. And what we found was that participants in the black defendant condition who expressed more likability ratings led them to consider the defendant's mental health more. And participants in the Black defendant condition who expressed lower ratings of cognitive function led them to take into consideration that defendant's mental health more in their sentencing decisions. So overall, what did we find? Well, participants were generally less likely to render guilty verdicts and to give those harsher sentences when the defendant had an autism label, and even less so when the offense that was allegedly committed was violent compared to nonviolent. A defendant's likability, honesty, and believability were rated higher when the defendant had an autism label, and these three considerations led to more lenient sentencing compared to participants who read about a defendant with no autism label. And finally, participants who expressed greater likability toward the defendant also reported greater consideration of their mental health, while higher perceived cognitive functioning led to lower consideration of that defendant's mental health in their sentencing decisions. So my study really highlighted the complex interplay between these defendant characteristics, the nature of that criminal offense, and public perception of autism within the criminal legal proceedings. So these findings really show that an autism label is going to significantly influence jurors' perceptions, often leading to more lenient judgments due to this increased likability and perceived honesty and believability associated with that autism label. However, our study also revealed patterns of racial bias and over-reliance on superficial judgments regarding a defendant. But overall, our results are going to emphasize the need for ongoing research, education, and policies to really address the treatment of an autism diagnosis within the criminal legal system. So thank you so much, and if there's any questions, I would love to answer them.
Another round of applause. Now we'll open up the floor for any questions that we have for Dr. Baker. Andy, oh, yeah, sorry.
I have a question. Is it a defense now using autism in the courts? Is that a defense that's mounted for criminals?
So it is something that the defendant could use as part of their case. So it is something that, depending on whether or not it's seen as a mitigating or an aggravating factor, so oftentimes you might have an expert witness who comes in to testify about what autism is. If you have plausible reason to believe that their symptoms led to some type of miscommunication, and that expert might be able to better explain some of those different behaviors during that interaction. So for instance, in our case that we gave individuals, when the violent offense of hitting the store worker happened, that assault and battery, right before it, there were loud noises and lights that were going off, kind of like a fire alarm. So thinking about that sensory input that might have escalated that, that juvenile's behaviors towards that store worker.
What got you interested in this study?
Yeah, so as far as what got me interested, so autism is actually what got me interested in psychology, to be honest. So it kind of goes all the way back. But throughout my career and my education, I started focusing on jurors' perceptions. And historically, I always looked at witnesses. And I always thought about child and adolescent witnesses, and specifically child witnesses of sexual assault. And I never really thought about how defendants are perceived by jurors, even though that's a huge part of the criminal legal system. So I think what got me interested is, first, I was invited to give a talk about autism within the criminal legal system and how experiencing autism can impact how you're interviewed within a forensic interview. And that kind of led me down rabbit holes of, well, how else is autism people who experience autism interacting with the legal system.
So they're juvenile defendants. Was there something in the scenario about them being specifically in an adult court? Was that explained at all?
It wasn't in an adult court, so it was.
Okay.
Yeah, so we left it very, like, we didn't say anything.
Okay.
So it was kind of up to them to, so like, it was a 15-year-old juvenile, and we didn't say anything about if it was a juvenile or an adult court. We just told them what the age was of the juvenile defendant and what that offense was, what they were charged with. But we didn't mention anything about which court system it was in. But yeah, that's a good thought. Yes?
Yeah, you said this is part of a larger project. So could you say a little bit more about that?
Yeah, so,
Any other pieces?
yeah, I mean, as far as the larger project, we also included different outcome variables like punishment decisions as well as stigma. So now that I have officially wrapped up this and submitted it for peer review, we're starting to look at that side of the paper. So as we were going through and analyzing our data, we really realized that it's too much for one paper. So we are now currently looking at how our experimental manipulations, then using stigma as the mediator and punishment decisions as an outcome impacts it. But I haven't yet delved into all of those analyses yet. I'm currently in my office doing that this week.
More questions?
I just have one more. So I was recently asked to be selected for jury duty. And so what does it vary, the people who are actually who make these decisions, have you looked at their demographic, conditions, and they're younger, they may have more sympathy, or if they're older, you know what I mean? Like, I could see that playing a really big factor in that. I mean, just because jury selection, that is like a massive variable.
Yes, so we haven't looked at the participant demographics other than just reporting like how many female males and their racial identity, but I think that brings up a really great point that individuals who are younger might have more education on the condition, and that might lead them to have more empathy towards this defendant compared to older individuals. So I think that's a really good next step type of thing to delve into.
Especially because are people, I don't know, I think there's a stereotype that older people are more likely to get on the jury. And
Yes.
so thinking about, there's the jury pool, but then there's who's actually selected to be on
Yeah.
the jury. And so actual jury decisions could really vary because of the specific makeup and who gets on the jury and who doesn't.
I do know in some cases where you think that mental illness is going to play a role in like the actual defense that they're using, they'll ask you specific questions about like your biases that you might have. So just like if you are potentially serving on a death penalty case, they're going to ask you your perceptions about the death penalty. And if you're someone who says, I absolutely will never use the death penalty, you're probably going to be excluded during jury selection. So kind of the same thing when thinking about the role of mental illness. They do kind of screen folks out who have strong beliefs towards certain individuals with conditions.
Any more?
I know you mentioned that particularly for folks of color that they are diagnosed less frequently or have less access to systems that can assist. Where's the research going? We mentioned that younger folks might be much more aware, but especially within the school systems and the school-prison pipeline, where's the scholarship going in terms of a greater understanding to be able to mitigate that factor?
Yeah, so as far as like thinking about the differences in diagnosing, I'm not super familiar with that line of research, but in general, what I do know is that I think more education is just being talked about what autism is. So for instance, even when you go to a pediatrician, when your child's 18 months, they have you fill out a questionnaire that is related to autism. Well, at least mine had me fill one out. So I don't know if it's all of them. But thinking about how they're kind of having that at different stages within those wellness checks And I think that's where they're trying to account for these discrepancies in those diagnoses, is making it a standard practice that all pediatricians and family doctors are doing some type of screening for all children to see whether or not we can catch that earlier, because we know, especially with autism, the earlier that intervention starts, the better the outcomes are for that individual.
And a follow-up question, just because you said you were interested in it, what about the major differences between male and female?
Yeah, so like male and female in
Autistic and how they present.
yeah, so thinking about that, we know that in ours, I didn't mention, but we used a male defendant, so a juvenile defendant who was a male. And the reason we did that is because going back to the diagnostic rates, we see that males are more likely to be diagnosed with experiencing autism compared to females. And when thinking about the symptom presentation, although we do see a high overlap, we see that sometimes, unfortunately, females are more likely to be diagnosed with an anxiety disorder instead of autism. So even though they're presenting with similar symptoms of autism, they're more likely to be diagnosed with another category, those anxiety disorders. You're welcome.
Any more? All right, so one more round of applause.
Thank you all for coming to listen to my research.
Thank you all for coming. This is one of